We're so excited to hear that you've booked your surgery with us here at Watt Plastic Surgery.
We're going to go through a few important details as far as your specific surgery and things that you need to know ahead of time so that you're able to have the best recovery possible.
We've created detailed videos for each procedure.
If you had arm lift surgery or brachioplasty, generally it's an incision from here down to your elbow, sometimes kind of crosses and comes down towards the side of your breast. As far as recovery with that goes, it's also important to do kind of T-Rex arms so that you're not stretching the incision or putting too much tension on it. The first day you'll shower. You may or may not have a drain in. You may or may not have had liposuction, so that can change your recovery a little bit. But for the most part, you'll take all the dressings off. There may be some tape over the incision or some little plastic clips. Leave those in place if they're there.
After surgery, you may find that you have ACE wraps around the arms. It's important to note that the ACE wraps, when reapplied, should be reapplied from the wrist up. Always wrap from far from the body towards it. This ensures that your hands and fingers don't get swollen from the wraps. If you purchase a surgical compression garment as instructed, your doctor will let you know when they'd like you to start wearing the official compression garment.
If you start wearing that too soon, you may put undue stress on the incisions just by trying to get into the garments, and that's the reason we don't want you doing it too soon. If you had a thigh lift, the incision for that usually goes kind of from about your knee up to your groin. You may or may not have had liposuction, you may have a drain, you may not, so that will affect your recovery a little bit differently whether or not you did. The first thing after surgery is making sure you don't do too much. The day after surgery, you'll be able to shower. Same thing as other surgeries, soap and water over the incisions very gradually. Just let it run off. Don't scrub too hard. Make sure that you're not up walking around too much or doing too much because that could cause issues. As far as dressings over the thighs, you may have some tape that's glued on. You may have some plastic clamps that are glued on. Those are generally supposed to stay in place for about a month. If they start falling off a little bit before that, it's fine, but for the most part, they'll stay on for a few weeks. So we've gone through all the things that you need to know for the specific surgery that you're having. Now, just a general list of things that you need to know, kind of regardless of what surgeries you're having or what surgeries you're thinking about having in the future.
Never use a heating pad after surgery. We do not want you applying any heat to the area.
That also goes for hair dryers and ice packs. Even though ice is not heat, it can still burn you and leave very not great looking scars.
No sexual activity for at least 4 weeks after any surgery.
No exercise. And I know exercise is, especially in South Tampa, everybody wants to do something. They want to exercise. They want to be out and about. You need to not. And exercise means no going for a walk, even around the block. No walking your dogs, regardless of how big or small they are. No weights on your lower body if you just had upper body surgery or vice versa. No yoga, Pilates, nothing. If it's something you have to think about whether or not we would say, yes, you can do it, you can't.
No swimming for at least 4 weeks after surgery and no baths. For optimal healing, it's important that you avoid smoking or vaping for at least 4 weeks after surgery. It's a really exciting time in the medical field with the age of GLP-1 medications. With that, we've got a couple restrictions and recommendations to ensure you have the best results possible with your surgery. With surgery, you're investing your time, money, and recovery to have an amazing result. But if you continue to lose weight after surgery, you may have excess skin that recurs that you'll want to remove. We want your results to last, so maintaining a stable weight within 10 to 15 pounds is crucial to ensure a lasting result.
If you're considering a tummy tuck or a breast reduction or breast lift, and you're considering losing more weight before you would want to have that surgery, you can have a consultation with one of the members of our team to talk about the GLP-1 medications and if those could possibly fit into your treatment process. The bottom line is just make sure that you lose whatever weight you want to lose before you have those surgeries. Try to get within 10 or 15 pounds of that goal weight before you have surgery. The other important thing is all of those medications kind of affect your nutrition and how much you're able to eat, which then means how much protein you're getting. That directly affects your wound healing. So even if you stop those medications, you need to make sure that you eat an adequate amount of protein for your body weight to be able to make sure that you have enough nutrition, that you're able to heal the incisions, and that you don't have poor wound healing or other complications in the immediate post-op period.
No matter where your surgery is done, from head to toe, no tanning or sun after surgery for 4 weeks. After 4 weeks, if you are going to go in the sun, it's important to put SPF 50 or above on any incisions, even if they're below the bikini. The sun rays can go through clothing and still cause darkening of your scars. After surgery, we want to ensure that you have the quickest healing possible and make sure that there's no medication interactions. A lot of supplements can cause inadvertent bruising, bleeding, or interact with the medications we prescribed you. The only medications or supplements that you can take have been advised to at your pre-op appointment. The only vitamins that we recommend or allow are a multivitamin for 4 weeks after surgery.
If you're having surgery, regardless of what surgery it is, you're going to have a coupon book that you go home with. One of the things in there that's important is discounted scar treatments. Those can be very important to make sure that you heal as best you can and that the scars look as good as they can. Your esthetician or nurse practitioner that you see will kind of know the best timing as far as when they want to start each one of those individual things.
Common treatments our estheticians provide for scar care are microneedling, laser therapy, and also pharmaceutical grade medical skincare to help for the best scars possible.